There is a gadget that is called a hypoglossal nerve stimulator. So that's new. It's come out in the last year and a half, and it's shown some very, very good success for people who have failed being compliant with CPAP. There are specific types of place in the airway that it has to work with. So that means the patient has to go through an endoscopy where we scope them when they're asleep, or at least pretty well knocked out. And then we look to see actually where the airway collapses. And if it meets the criteria to where we think that hypoglossal nerve stimulator will work, then they would be eligible for that. And then the ENT surgeons are the ones that put that in. We're doing those, actively doing the sleep endoscopy, which is called DICE. We do it at the VA, we do it at the university, and our team is in training right now for putting the device for the hypoglossal nerve. Our surgeons are training for that. So we're making headway in that department. There are some other gadgets, such as an oral appliance. I tell people when they say, what does it look like? I show them on the internet in the office some pictures of things. And I said, it's like a fancy football guard. And it actually helps to bring the bottom of the jaw forward. And so there are criteria for that. Their teeth have to be in decent shape. They can't have TMJ problems, or really, if their bruxism is horrible. There have been a couple people who have broken the devices, but most of the time we have pretty good results with those. You need to have a dentist who is trained in that area, that really knows how to fit them. You know, they take a mold just as if you were going to get dentures and goes to a lab, but that's kind of the easy part. The hard part is that you actually have to, do either CT or radiographic films to see whether or not there's problems with bone structure and whether or not their airway is amenable to doing that. You can only advance those so far. There are some tongue retractors that are simple. Those, maybe they can advance a little bit. The next phase is going to be besides the hypoglossal nerve stimulator, which is like a little mini pacemaker, would be very big surgeries, where you would do palate surgeries or actually cutting bone. So for some people that's the right thing to do. Children who maybe had some malformations, that might be the best way to go. So it just depends. Each patient is a little bit different. The diagnostic equipment, though, is getting to where we're doing it more at home. And we're doing it with less belts, less irritating things that would bother you, and trying to actually, the difficulty is when you do a home study, you don't have a guarantee, was the person really asleep or what stage of sleep? But there are a couple devices that are out there that can actually help you to kind of have a better estimate that they're asleep, as opposed to putting all the EEG type signals on there, which everybody says, I had to lay completely flat, and how can I sleep with that? And so that's an area where there is more research going on. We're not getting smaller, and when the data came out back in the 90s, the epidemiologic data, that there was probably 4% of men and 2% of women that had sleep apnea syndrome. That was probably the low ball. And that just looked at a sample of 5,000 patients in the community. But it didn't look at those who were symptomatic versus not symptomatic. They just were in the community. We know that at the VA, there's probably about 80% of patients that have sleep apnea. And I'm guesstimating that when we really look at our population now, it's probably 25% in the community, certainly that has mild. I think that as kids are getting heavier, we're going to see nothing but a rise. I think that we will see that we'll try to do more of pharyngeal stimulators, I think, for some of that. Speech therapy training is also something that has been shown to be helpful because it increases tone. So some of those type things, unfortunately, we don't have a magic bullet pill, because that would be nice, because the consequences of sleep apnea are the consequences of any kind of sleep deprivation, which is people have a higher risk of mortality, high blood pressure, diabetes, strokes, poor work performance. All of those type of things will be impacted.